Doctors told her it was normal. She was told to relax. She was told it was anxiety. Years later, she finally got a diagnosis. Women's pain is ignored by medicine, and it happens every single day. This video explains why women are dismissed, how the medical system was built to overlook female pain, and why so many women are made to feel crazy when something is actually wrong. If you've ever felt unheard by a doctor, this video is for you. Women around the world report the same experience. Their pain is minimized. Their symptoms are normalized. Their concerns are dismissed. Women are more likely than men to wait longer for diagnosis, be told their pain is psychological, be prescribed antidepressants instead of treatment. This isn't about one bad doctor. This is a systemic pattern. When the same thing happens to millions of women across countries, cultures, and healthcare systems, it's not random. It's structural. Think about it. When women from Tokyo to Toronto, from Sydney to Sao Paulo, all report identical experiences of being dismissed, told to calm down, or having their symptoms attributed to stress, this isn't coincidence. This is evidence of a deeply rooted problem in how medicine approaches women's bodies and women's pain. The statistics are staggering. Women wait an average of 4 years longer than men to receive a diagnosis for the same condition. Women reporting abdominal pain in emergency rooms wait significantly longer for pain medication than men with identical symptoms. Women suffering from heart attacks are more likely to be sent home from the hospital because their symptoms don't match the textbook presentation, a textbook written primarily based on male patients. Medicine wasn't designed for women. For decades, medical research focused almost entirely on men. Male bodies were considered the standard. Female bodies were considered too complex. Why? Because women have hormonal cycles, monthly fluctuations, symptoms that change week to week. Instead of studying this complexity, medicine avoided it. Women were excluded from clinical trials. Female pain responses were under-researched. Hormonal variation was treated as a nuisance. So when women experience symptoms that don't match male-based models, medicine often fails to recognize them. Not because women are wrong, but because the system is outdated. Until 1993, women of childbearing age were routinely excluded from clinical drug trials in the United States. The reasoning? Researchers claimed it was to protect potential pregnancies. But the result was that medications, dosages, and treatment protocols were developed and tested exclusively on men, then prescribed to women as if their bodies worked identically. The consequences have been severe. Women experience adverse drug reactions at nearly twice the rate of men. 8 out of 10 prescription drugs withdrawn from the market between 1997 and 2001 posed greater health risks to women than men. Even today, medical textbooks still primarily feature male anatomy as the default. Symptoms of heart attacks, strokes, and other critical conditions are taught based on how they present in men. When women experience these same conditions differently, their symptoms are more likely to be misinterpreted or overlooked entirely. Women are taught to tolerate pain. From a young age, women are taught that pain is normal. Painful periods? Normal. Severe cramps? Normal. Feeling exhausted every month? Normal. Missing work because of symptoms? Normal. Men are taught pain is a warning sign. Women are taught pain is something to endure. So by the time women see a doctor, they've already minimized their own suffering. And when the doctor dismisses it, the message is reinforced. Maybe this really is just in my head. That's not strength. That's conditioning. This conditioning starts early. Young girls experiencing debilitating menstrual pain are told it's just part of being a woman. They watch their mothers, aunts, and older sisters push through pain without complaint. They internalize the message that suffering in silence is what good women do. By adolescence, many women have already developed a high pain tolerance, not because they're naturally tougher, but because they've been socialized to dismiss their own discomfort. They learn to function through migraines, to work through cramps that would send most people to bed, to smile through pain that deserves medical attention. When a woman finally seeks medical help, she's often downplaying her symptoms because she's been conditioned to believe they're not that serious. She might describe excruciating pain as uncomfortable or severe symptoms as a bit bothersome. What medical gaslighting looks like? Your tests are normal. It's probably stress. That happens to a lot of women. You're just sensitive. Try to relax. These statements don't investigate the cause. They end the conversation. Medical gaslighting doesn't always mean intentional harm. It means dismissal without curiosity. And women experience it most with hormonal disorders, autoimmune conditions, chronic pain, reproductive health issues. That's why many women spend years searching for answers while being told nothing is wrong. Medical gaslighting is insidious because it often comes wrapped in reassurance. Your test came back normal sounds like good news, but when you're experiencing debilitating symptoms and the tests show nothing, normal results don't feel reassuring. They feel invalidating. One describes symptoms that significantly impact her quality of life. Instead of deeper investigation, she's told to lose weight, reduce stress, or try yoga. The assumption is that lifestyle factors are causing her problems, not that her problems might have a medical cause. A woman reports the same symptoms repeatedly over months or years. Each time, she's given the same dismissive responses. No one connects the dots. No one asks why these symptoms persist. The healthcare system places the burden of proof on the woman to demonstrate that something is genuinely wrong, rather than on the medical system to investigate why she's suffering. What's actually happening in your body? Here's the truth. Your body is not betraying you. It's communicating. Hormones influence pain sensitivity, inflammation, mood, energy, digestion, and hormones don't stay the same all month. They shift weekly. But medicine often tests hormones once, out of context, using outdated reference ranges. So when results come back normal, women are told nothing is wrong. That doesn't mean you're healthy. It means the system didn't look closely enough. Understanding female hormones requires understanding cycles, patterns, and relationships between different hormones throughout the month. A single snapshot blood test on day 15 of your cycle tells you almost nothing about your hormonal health. It's like taking one photograph of the ocean and claiming to understand the tides. Estrogen, progesterone, testosterone, cortisol, thyroid hormones, insulin, these don't work in isolation. They're in constant communication, influencing and responding to each other. When one hormone shifts, it creates a cascade of effects throughout your entire system. Standard lab ranges were developed based on populations, not individuals. They tell you whether you fall within the range of what's statistically common, not whether your hormones are optimal for your body. Why this makes women feel crazy: repeated dismissal damages trust. Women stop trusting doctors, their bodies, their instincts. They begin to believe, I'm just bad at handling life. I'm too emotional. I'm overreacting. That belief is one of the most harmful outcomes of medical gaslighting. Because when women finally receive a diagnosis, the most common response isn't fear. It's relief. Relief that they weren't imagining it. The psychological impact of repeated medical dismissal cannot be overstated. When you're in pain, when you know something is wrong with your body, and when authority figures repeatedly tell you that nothing is wrong, you begin to question your own sanity. Women who have been repeatedly dismissed often describe a growing sense of confusion and self-doubt. They start monitoring their symptoms obsessively, trying to gather evidence to prove to doctors that something is genuinely wrong. The dismissal itself becomes traumatic. The gaslighting creates anxiety and depression that then gets cited as evidence that the original symptoms were psychological all along. This is why diagnosis, even diagnosis of a serious or chronic condition, so often brings relief. It's validation. It's proof. It's confirmation that you weren't crazy, weren't weak, weren't imagining things. Why this channel exists? This channel exists because women's pain is ignored, minimized, and normalized. You deserve explanations. You deserve curiosity. You deserve to be believed. If this video resonated with you, you're not alone. This channel talks about women's health without gaslighting and without pretending suffering is normal. If you're tired of being dismissed, subscribe to this channel. You're not crazy. You're being ignored.